After years of living with cancer, Supreme Court Justice Ruth Bader Ginsburg passed away Friday from complications with metastatic pancreatic cancer. Over the years, she suffered several battles with different types of cancer. Here to talk about those battles this morning is Dr. Scot Ackerman. Thank you so much for being with us this morning.
Good morning. Thank you for having me.
And doctor, for those of us who are unfamiliar, can you tell us a little bit about metastatic pancreatic cancer?
Well, metastatic pancreatic cancer is terrible. Pancreatic cancer is a very difficult diagnosis to have. It's a very difficult cancer to treat because it's diagnosed frequently at a fairly advanced stage, and it does metastasize very frequently. And when it metastasizes, it generally metastasizes to the liver or to the lungs. And metastasis means that the cancer spread from the original organ where it was diagnosed to another organ in the body, or to lymph nodes in the body. So pancreatic cancer usually starts in the pancreas. Unfortunately, it's silent and there's not too many symptoms with it until it's more advanced, when it causes some abdominal pain. And at that point, with abdominal pain, it's already either grown into the nerves in the abdomen, or metastasized to the lymph nodes, or to other parts of the body.
And you mentioned that it can be early to catch, or hard to catch early. What should people be looking for?
So with pancreatic cancer, it's very hard to catch early because when it is small, it's asymptomatic, meaning the patients have no symptoms. But things to look for that may clue you to the fact that you might have pancreatic cancer is abdominal distress or discomfort, problems with digestion. In more advanced stages, as I said, some back pain. So if it grows into the nerves in the abdomen there, you might experience some back pain in the mid part of the back. And then even more advanced, it could grow and cause obstruction of the ducts of the pancreas and of the liver, and patients could be what we call jaundiced, and that's where their skin is yellow or their eyes are yellow, and that's a little bit more advanced.
And she was 87 when she died. How difficult can this type of cancer be for someone that age?
Well, certainly as people get older, their resiliency is weakened and it's difficult to fight different cancers. But Ruth Bader Ginsburg was a wonderful, dynamic woman. And when she was first diagnosed with cancer in 1999, at that time it was colon cancer. She had surgery and radiation and chemotherapy. She decided to make sure that her health was in good shape. And she hired a trainer and trained every day. And she did push-ups. And we've seen all sorts of great things about her and her resiliency. And I think that her health and the fact that she exercised and stayed active and continued to work on the Supreme Court all through these years really helped her to fight her cancer and helped her to be able to tolerate the treatments, the surgery, and the radiation that she needed to live as long as she did with cancer and to fight it as well as she did for so many years.
And as you mentioned, it is remarkable that she did continue working out. We've seen that throughout the years as she battled several bouts of cancer. How important is that for people to continue doing?
Yeah, I speak to my patients about this all the time. We talk about diet and exercise, and staying healthy really helps patients get through treatment. I'm not sure it's necessarily going to cure your cancer by running or by doing push-ups or changing your diet, that in and of itself. But by being on a good diet and exercising properly, maintaining your health, it means that you'll be able to get through your treatments properly and not have to have an interruption in treatment, be it surgery or radiation or chemotherapy. It means you'll be more resilient and and your body's immune system will be able to work with the therapies to fight the cancer properly.
Dr. Scot Ackerman, thank you so much for being with us this morning.
Thank you for having me.